Hi, I'm Nell, and I'm the founder and CEO of Folia, and I'm here with my mom. My mom is the reason that we started this company. I had found through watching my mom over many years take care of my younger brother that she has so many observations that she's made over the years that were really instrumental to my brother's care. And it helped me to realize that there are so many people like my mom who have made these observations over time, and if you could just catalog that information in one place in a data format, the observations of family members and patients are really valuable to figuring out what care works for who, and how we can make better, more precise decisions about treatment. So I asked my mom to talk with me a little bit about some of the experiences that she's had making observations of my brother and how that helped his treatment.
Yeah, so I guess the first one, the most easily described one, was when he had started IVIG at age 4. The guidelines, primarily I think because of insurance reasons, were that he was to receive it was amount of gamma globulin that was calibrated by his height and his weight and his age. And we discovered that after 3 weeks, every month, at the third week of the cycle, he would start becoming ill, that fourth week. So we went back to our primary, and he went back to the immunologist, and they determined that that we knew that over time, over the course of a month's time, that the gamma globulin in his blood would decrease, and that the immunoglobulins would be decreasing as well, and therefore it was necessary for him to stay healthy that he have that infusion rate every 3 weeks instead of every 4. And it was a relatively simple fix, but the reason we were able to determine that and to fix it fairly quickly was because we had the information of my cataloging every that third week what would happen.
Yeah, and then it got better.
And
right?
It did.
It was a simple fix of having this very important treatment once every 3 weeks instead of once every 4 weeks because of what you noticed.
Decrease the amount of pneumonias. He'd been getting pneumonia on a fairly regular basis. Decrease that. There are certain conditions that are chronic. You're just going to have them anyhow, but it certainly made them less of a problem. And we also saw anecdotally that when his gamma globulin levels were higher, other things were better as well.
Mm-hmm, mm-hmm.
So.
And you've also had situations where things that you noticed actually caused different diagnoses, right? Not just changes in treatments, but actually, I think we were talking about the arthritis diagnosis and how that happened.
Right. So his arthritis is not serum positive, so it doesn't show up in blood work. He was about 2 years old, I'd say, and I noticed that he was walking rather funny. He was limping, and his joint wasn't warm. It wasn't red. None of the outward signs of arthritis. So I took him into the allergist, rheumatologist, and he took a look and was like, yeah, I can tell he's in pain. We did the blood workup, we did the X-rays, and there was nothing to show that he had it except that we had the symptom, and we continued to track it over time. And of course, he does have arthritis.
And it turned out that he does have arthritis, but you're the only one who noticed for a long time, and you couldn't prove it otherwise, except for the symptomatology.
No.
Yeah. So this is just a small sample. I'm sure that if we had 100 other parents, family members, and patients in the room who have their own conditions, they would have just as many stories. We've actually had some on our blog, your stories on our blog, and we've had other stories on our blog of people talking about the exact same thing. And so really what we're working on at Folia is taking that and putting it into a format where you can look at it across many patients, because can you imagine if we were able to say, here are 50 people like you who have all noticed that when they give their kids IVIG every 3 weeks instead of every 4 weeks, it's more effective and the kids are much less sick over time. And that type of insight that you can create when you are collecting this data could actually be used to change the way that all kids are receiving a IVIG treatment. And so that's kind of it's not really rocket science, it's the power of the observations that the parents and the patients are making.
And it also leads to research. So for example, I just know from reaching out to other people at conferences and that we go to for his immune issues, he had a series of remarkable fevers when he was 2-3 years old that were off the charts, 105, 106 fevers. And since that time, he's never had a fever. And talking to other parents of people with similar conditions, that's been their experience as well. We can't explain it. We just know that that's true. So when you provide that kind of data set to a researcher, then they can start to, dig a little
Uncover
deeper.
why.
Right.
Yeah.
And see if there's something there that may be helpful in treatment long term.
Yeah. Well, thank you all for listening. Thank you, Mom.
Thank you.